Good morning, everyone, and welcome to yet another OET Writing Live airing from Teachers Academy. And this is Ishwarya here with you, people. So, very warm good morning. So, it's raining outside, so I hope everyone is safe and good. So, very warm good morning to each and everyone out there. So, let's just wait for a couple of seconds so that our viewers can be here with us. Yes, good morning, Maria. Good morning and welcome. Yes, good morning, everyone. So good morning each and everyone to yet another OET Writing Live airing from Teachers Academy, and this is Ishvara here with you people as usual. And today, as you people can see, we are going to discuss in another area where the student often feel confused when analyzing the question paper. So question paper analyze ചെയ്യുന്ന സമയത്ത് നമുക്ക് കൺഫ്യൂസിംഗ് ആയിട്ട് തോന്നുന്ന കുറച്ച് ഏരിയാസ് കൂടെയാണ് നമ്മൾ ഇന്നത്തെ ലൈവ് സെഷനിൽ ഡിസ്കസ് ചെയ്യാനായിട്ട് വെച്ചിരിക്കുന്നത്. So as you people can see, the title of or the topic or the main discussing area will be confusing unknown cases in OET writing. OET writing നമുക്ക് unknown cases confusing ആയി വരുന്ന ഒരു സിനാരിയോ വെച്ചിട്ടുള്ള ഒരു അനാലിസിസ് ആയിരിക്കും നമ്മുടെ ഇന്നത്തെ ഒരു ഡിസ്കഷൻ എന്ന് പറയാം. So here I welcome everyone to this brand new episode of OET Writing Live airing from Teachers Academy, and this is Aishwarya as usual with you people. Yes, good morning Sri Lakshmi, welcome and welcome to the session. All right, so let's just get started with our today's writing live. So in order to understand the confusing scenario, I have brought a question paper or a case note for the discussion. So you're a confusing situation discuss ചെയ്യാനായിട്ട് വേണ്ടിയിട്ട് ഞാനൊരു question paper ഒരു OET case note ആണ് നമ്മൾ ഇന്നത്തെ ഒരു ലൈവിന് കൊണ്ടുവന്നിരിക്കുന്നത്. So as you people can see, this is going to be the question paper that based on which we are starting with our discussion. So read the case note and complete the writing task below. So that is going to be that is what we have often seen in every question paper. So Alex David is a 45-year-old man who is regular patient at your medical center. So നമ്മുടെ patient ആരാണ്, അവർക്ക് എത്ര വയസ്സുണ്ട് എന്നതിനെ പറ്റി നമുക്കൊരു ഐഡിയ കിട്ടി. And when it comes to the patient history, yes, Devadarshini, good morning dear, happy to see you here as well. Okay, and employed as a builder. So when it comes to this particular patient, he is a builder and the present occasionally with the lower back pain clears up with anti-inflammatory medication. So your patient occasional ആയിട്ട് നമ്മളുടെ അടുത്ത് വരുന്ന ആളാണ് with the lower back pain. That is the main concern of the patient, and he often subsided his pain with anti-inflammatory medications. So anti-inflammatory medications എടുത്താണ് ഇവർ അവരുടെ പെയിൻ എന്ത് ചെയ്യുന്നത് often subside ചെയ്യുന്നത്. And the spinal x-ray a year ago showed narrowing of L4 L5 and signs of osteoarthritis in L5 and S1. So spinal x-ray എന്ത് ചെയ്തു or a year ago showed narrowing of L4 L5 and signs of osteoarthritis in L5 S1. So spinal x-ray ഒരു ഡീറ്റെയിൽസും നമുക്ക് തന്നിട്ടുണ്ട്. And he already has NIDDM, so non insulin dependent diabetes mellitus ഉണ്ട്, which is controlled with the diet and exercise എന്നുള്ള ഇൻഫർമേഷൻ നമുക്ക് അവൈലബിൾ ആണ്. Okay, now moving on to the next page where we could see the present situation of the patient. Okay, so when it comes to this patient history part, there itself they have served the social history and the medical history of the patient. So the patient history എന്ന് പറയുന്ന ഒരു ജനറൽ ടൈറ്റിലിൽ തന്നെ ഇവിടെ പേഷ്യൻറ്റിൻ്റെ സോഷ്യൽ ഹിസ്റ്ററിയും മെഡിക്കൽ ഹിസ്റ്ററിയും നമ്മളുമായിട്ട് എന്ത് ചെയ്തിട്ടുണ്ട്, ഷെയർ ചെയ്തിട്ടുണ്ട്. Now we are going with the present situation of the patient where he presented in 2018 12th February patient നമ്മളുടെ അടുത്ത് present ആവാണ്. And sudden onset of lower back pain yesterday while working worse than usual. So he has got a sudden onset of lower back pain, worst on left side, radiating down towards back of left thigh. So he took Nurofen, which settled pain, but worse this morning, unable to go work. So he had the sudden onset of pain on his lower back, and at the worsened eye, he took painkiller, but he couldn't go to work today. So put hands on left hip when walking, walk slowly. Tender around lower spine and spinal muscles. So lower spinal muscles and tenderness feel ചെയ്യുന്നുണ്ട്. SLR positive on left side at 45 degree. So SLR, what is SLR, guys? So can anyone tell me in the comment box what is SLR, which is positive, on the which is on the left side is 45 degree. What is SLR? Can anyone tell me? Yes, SLR. And the leg power and reflex is normal, pain inhibiting, lumbar flexibility and extension. So leg power and reflex is like a normal ana, but the pain is inhibiting or obstructing the lumbar flexibility and extension of his leg. So I asked the question like, what is SLR? XLR is straight leg raise. So that is positive on left side at 45 degree. So that is going to be the SLR value of his leg raise. And the assessment shows possible disc prolapse or nerve root irritation from facet joint. Treatment നമ്മൾ paracetamol and anti-inflammatories provide ചെയ്തിട്ടുണ്ട്. Hot water bottle on the bag, return in 2 days എന്ന situation പറയുന്നു. Bed rest for 2 days as well also mentioned. And on the coming days, what happened with the patient is no change in back pain or leg pain. Neurological examination seems to be normal, but it says no worse than before. Still difficult with the movement, and the degrees are also mentioned there. And moving on with the next set, that is again the assessment, which shows no improvement but worsening, and they continued with the NSAIDs. And in the upcoming days also his condition got deteriorated day by day, and his SLR got reduced to 30 degree. Earlier it was 45 degree. Now this SLR value has reduced to 30 degree. This is what happened with the patient also. And the assessment is again mentioned there. And on 19th February 2018, what happened with the patient is he called urgently to patient home. Pain increased overnight in back and down, left leg pain, not controlled by any medication. And the lower leg has become numb. Pain caused inability to get out of bed. SLR value is again 10 degree. It has deeply reduced to 10 degree. And 34 degree right leg, also no ankle flexion. Decreased pinprick sensation in areas. Random blood glucose increased to 14 mmol. And that is what happened with the patient. And again the condition is not relieved with the medication. Signs indicative of nerve root compression and disc prolapse. So the ambulance transport to Royal Melbourne Hospital emergency department arranged, and phoned orthopedic registrar, arranged for hospitalization and orthopedic assessment. So using the information in the case now, write a letter of referral to Dr. Matthew Sebastian, Royal Melbourne Hospital, Melbourne, and the pin code is also mentioned here. So here comes the main part of this particular discussion. So where when I was starting this particular live class, I told you that confusing unknown cases നമുക്ക് OET ലെറ്ററിൽ വരാനായിട്ട് ചാൻസസ് ഉണ്ട്. ഫോർ അതിനൊരു എക്സാമ്പിൾ ആണ് ഇവിടെ തന്നിരിക്കുന്നത്. സോ ബിഫോർ സെൻഡിങ് ദ പേഷ്യൻറ്റ്, ദേ ഹാഡ് മെയ്ഡ് എ കോൾ. അവരുടെ ഫോൺ വിളിച്ച് ഓർത്തോപീഡിക് രജിസ്റ്ററിനോട് കമ്മ്യൂണിക്കേറ്റ് ചെയ്തു, ഇങ്ങനെ ഒരു പേഷ്യൻറ്റ് വരുന്നു എന്നുള്ള കാര്യം ഓൾറെഡി കമ്മ്യൂണിക്കേറ്റ് ചെയ്തു എന്നാണ് നമ്മളോട് പറഞ്ഞിരിക്കുന്നത്. ആൻഡ് വാട്ട് ദേ വോണ്ട് us then arranged a hospitalization and orthopedic assessment. So ഹോസ്പിറ്റലൈസേഷനും ഓർത്തോപീഡിക് അസസ്മെൻറ്റും ആണ് അവിടെ കൊടുക്കേണ്ട അറേഞ്ച്മെൻറ്റ്സ് ചെയ്യേണ്ട കാര്യം. വിച്ച് മീൻസ് ദ പർപ്പസ് ഓഫ് ദിസ് പെർട്ടിക്കുലർ ലെറ്റർ ഇസ് ഗോയിങ് ടു ബി hospitalization and orthopedic assessment, or you could say orthopedic assessment and management എന്നും നിങ്ങൾക്ക് ഈ ഒരു പെർട്ടിക്കുലർ ലെറ്ററിൽ പറയാവുന്നതാണ്. Okay, and yes, Aaron, good morning, welcome. And Balvinder, good morning. Hey Balvinder, nice to see you here. I'm your student. Okay, all right. Okay. Yes. So on every Monday, we will be having the speaking class, speaking live session. That is on every Monday at 10 a.m. And on Wednesdays, by 10:30, you will be having your writing session. And on Thursday in the morning, you will be getting your listening, and by evening, you will be getting your reading class. Okay. Yes, very good, Aaron. Aaron, that's correct. The orthopedic evaluation and management, that can be the perfect purpose for this. So, Balvinda, I hope you got the a live schedule. On Mondays, we will be having the speaking live class at 10 in the morning, 10:15 in the morning to be very precise. And on Wednesdays by 10:30, we will be having the writing class. Today, we got a bit delayed because of the technical glitches that we faced during the airing time. So, normally, the writing classes will be at 10:30 on every Wednesdays, and the listening and reading class are going to be on the same days, that is on Thursdays. In the morning at around 10:30 you will be getting your listening class, and by evening 4:30 you will be having your reading class. So I hope it is clear, Balvinda. All right, so hope to see you in every classes. All right. Okay, so let's get back into our discussion. And using the information in the case note, write a letter of referral to Dr. Matthew Sebastian. Dr. Matthew Sebastian, hospitalization and orthopedic assessment, or I could say orthopedic assessment and further management. We are sending this patient to Dr. Matthew Sebastian. And this is a one area where you will be having a slight confusion, or you may tend to make a mistake. That is, while in the writing task, they have mentioned the name of the doctor and the address of the doctor, but they haven't provided the designation over here. അവർ correct ആയിട്ട് ഇവിടെ designation നമുക്ക് എന്ത് ചെയ്തിട്ടില്ല, writing task provide ചെയ്തിട്ടില്ല. But when it comes to the last treatment plan, it is mentioned that they have called the orthopedic registrar and arranged for hospitalization and orthopedic assessment. All right, so they have called this orthopedic registrar, which means we are this, the designation of this doctor Matthew is gonna be orthopedic registrar ennulla karyana. Yes, Balvinda, thank you. I mean, you are always welcome, dear. Okay. All right, so orthopedic register, that is going to be the designation of the reader. So while you are writing the address of the letter, you have to correctly mention the designation. You shouldn't miss that particular part. Okay, so that is one point. And the second thing that we could identify from this particular treat plan is the hospitalization and orthopedic assessment are going to be the purpose word. So either you can make hospitalization and orthopedic assessment as the purpose word, or you could say orthopedic assessment and management, or orthopedic evaluation and treatment. These three are the pair of purpose words which you can write in the introduction of the letter as well. Okay, and the another confusing part that often tend to make a mistake is here they have mentioned that they have phoned the orthopedic register and arranged for hospitalization. So they had made a phone call and they had just made an arrangement for hospitalization, and it is not practically possible to convey all the relevant information of the patient through a phone call. Or phone call kuda patient ne pattiyulla ella relevant information namukku endu cheyanayittu pattilla, convey cheyanayittu pattilla. So even though they have made a phone call over here, you have to take this particular case as an unknown case. Nikku complete ആയിട്ടും ഇതിനെ ഒരു unknown case ആയിട്ടാണ് എടുക്കേണ്ടത്, even though they have made a phone call. So phone call പറഞ്ഞു informed ആണ് എന്നുള്ള ഒരു കേസിൽ, please don't tend to go for a non scenario over here. So I hope you people got the connection over here. Okay, and see, that is one point of unknown cases enna paraya. See, normally how we are analyzing the known and unknown cases are, there are certain criteria based on which we could analyze which is going to be a non case. So if it is not a non case, normally we will be taking it as, automatically we will be taking it as unknown case. So non case scenarios ഏതൊക്കെയാണ് നമ്മൾ പഠിച്ചു വെക്കുന്നു. അപ്പം നോൺ അല്ലാത്തതെല്ലാം നമ്മൾ എന്തായി എടുക്കുന്നു, unknown ആയിട്ട് എടുക്കുന്നു. This is what we normally do. പക്ഷേ ഈ ഒരു കോണ്ടെക്സ്റ്റിൽ ഒരു ഫോണിൽ കൂടെ ഇൻഫോം ചെയ്തു എന്ന് പറയുമ്പോൾ you may be slightly getting confused to choose this particular case note as a non one, but please try to understand through the phone call we won't be able to communicate each and every single relevant details of the patient. So even though they have made a phone call, you have to take this particular scenario as an unknown case. So I hope it is clear so far, and let's analyze in another point. So this is going to be a referral letter, so you can take it as I am writing to refer the patient name who requires, and the purpose word we have already discussed, that is orthopedic assessment and further management, or hospitalization and orthopedic assessment. Now we need to identify why we are sending this patient for an orthopedic assessment, the current medical status of the patient, or the reason behind providing this orthopedic assessment. That has to be identified from this particular slide. So can anyone tell me what is the current medical status of the patient from this particular slide that you have identified? If you have identified, എന്തായിരിക്കാം നമുക്ക് പേഷ്യൻറ്റിൻ്റെ മെഡിക്കൽ കണ്ടീഷനായിട്ട് ഇവിടെ പറയാൻ പറ്റുന്ന സിറ്റുവേഷൻ എന്ന്? Can anyone tell me, those who are watching the live right now? Yes. All right, Maria. Okay, yeah, that's the right purpose word. I understood. Okay. Yes, what is going to be the correct purpose word? I mean, the current medical condition. Yes, from the assessment part itself, we can identify that. Yes. All right. Yes, very good. Actually, here it is mentioned that the condition not relieved by medication and the signs indicate nerve root compression and disc prolapse. Power condition medicine which relieved and the signs indicate nerve root compression and disc prolapse. Exactly, very good. But this is an indicative scenario. We are not sure of it. So the indicate that is going to be a nerve root compression and disc prolapse, which means we are not sure whether the patient is having it or not. So how we have to write it in the introduction is you have to take this particular situation as a suspected scenario, because the signs shows that this is a condition, but we are not sure. Okay, so as we are not sure, you could write in the introduction as he is suspected to have nerve root compression and disc prolapse. This is how you have to write. Okay, I hope it is clear so far. We are clear with the introduction. I am writing to refer Mr. Alex David, who requires orthopedic assessment and management. He is suspected to have nerve root compression and disc prolapse. This is going to be the introduction of this particular letter. So from this slide, we have identified the current medical status, the purpose word, and the right way to identify the confusing scenario of the unknown case over here, and the address part as well. Okay, so this is what we have to take it from here. All right. Yes, very good, Alan. I am writing to refer Mr. X, who requires orthopedic assessment and further management. He has been suspected to have, in the normal parayanda karila, you just need to write he is suspected to have nerve root compression and disc prolapse. He is enough. You don't need to go for he has been. Okay. Okay. I hope it is clear. He is suspected to have nerve root compression and disc prolapse. Very good, Balvinda. Yeah. All right. Okay, so now let's develop the body paragraph as well. So as we have discussed this introduction, we can develop the body paragraph of this letter as well. So I told you this particular patient, both the social and medical history is provided in the same slide itself. So it's employed as a builder. So by profession, he is a builder, and he occasionally presents with a lower back pain and his spinal x-ray and year ago shows narrowing of L4, L5 and signs of osteoarthritis in L5S1 as well. So we could say, understand that the patient is already having lower back pain for the couple of months, right? So and he occasionally presents with the lower back pain as well. You can start the letter by mentioning the history of the patient, because in the history itself we could see that the patient is suffering with the condition. And we can write this particular letter with a social and medical, start the body paragraph with the social and medical history. So social history, he is employed as a builder. So Mr. David is a builder, and his x-ray showed narrowing of L4, L5 and signs of osteoarthritis in L5S1. This is something you can write. And you could say that he has had NIDDM, which is controlled by diet and exercise. Diet and exercise which control cheyunna NIDDM ayalku nerathe thotte undu. So if he already has this condition, you have to write it as he has had NIDDM, which is controlled by diet and exercise. So I hope you got the first paragraph, that Mr. David is a builder whose x-ray showed narrowing of L4, L5 and signs of osteoarthritis in L5S1, and he has had NIDDM, which is controlled with a diet and exercise. This is what you could write as the first body paragraph. And from this, he occasionally presents with a lower back pain, which could be mentioned in the present. So or you could write it in the body paragraph, first medical history itself. He has occasional lower back pain. He has occasional, because he's still having it, right? Occasionally means once in a while he is coming up with it. So you could write he has occasional lower back pain for which he takes anti-inflammatory medications in the body present condition. So social and medical history so social and medical history he is Mr. David is a builder whose x-ray shows narrowing of sentence and he has had NIDDM, which is controlled with the diet and exercise, and he also has occasional lower back pain for which he takes anti-inflammatory medication. So this much information can be considered or put it in the first body paragraph of the letter. And we have discussed the introduction and the first body paragraph as well. Now we are moving on with the present. Present. So you could start with the first date. Initially, since it has multiple date, you don't need to mention the first date. You could say initially. Initially, Mr. David presented with sudden onset of lower back pain, which is worse than usual, especially on the left side, radiating down towards the back of left thigh. Okay, and his pain was settled with Nurofen, but he was unable to go to work. So, and you could mention all these things. Mention he had tenderness around lower spine and spinal muscles, and his SLR value was 45 degree, and his pain is inhibiting the lumbar flexibility and his extension. And his assessment shows the possibility of disc prolapse and nerve root irritation, and he was suggested for bed rest and paracetamol and anti-inflammatory, and along with a hot water bottle on his back. Initial content mention and initial treatment you don't need to go with the detail. You could say he was advised for bed rest for 2 days, hot water bottle on neck, on the back, along with paracetamol and anti-inflammatory medications after food. And then we mention ini other കാര്യങ്ങൾ 14 എന്ന് പറയുന്ന ഒരു ഡേറ്റിൽ ഇഷ്യൂസ് ഉണ്ട്. 14 ഡേറ്റ നമുക്ക് തന്നിട്ടുണ്ട്, 16 ഡേറ്റ നമുക്ക് തന്നിട്ടുണ്ട്. സോ ഈ രണ്ട് ഡേറ്റാസ് ആണ് തന്നിരിക്കുന്നത്. സോ ഈ രണ്ട് ഡേറ്റയിലും വാട്ട് യു കുഡ് സീ ഇസ് ദ കണ്ടീഷൻ ഹാസ് ബീൻ ഡിറ്റീരിയോറേറ്റിംഗ് ഫോർ ദ പേഷ്യൻറ്റ്. ഈ രണ്ട് ഡേറ്റയിലും പേഷ്യൻറ്റിൻ്റെ കണ്ടീഷൻ എന്താവാണ്? ഡിറ്റീരിയോറേറ്റിംഗ് ആവാണ്. നോ ചേഞ്ച് ഇൻ പെയിൻ ഇൻ ബാക്ക് ഓർ ലെഗ് പെയിൻ, no worse than before, still some difficulty with the movement. So അപ്പോൾ അയാൾക്ക് ഓൾറെഡി ആ പെയിനിന് ചേഞ്ച് ഒന്നുമില്ല. സോ ഹി ഓൾറെഡി ഹാസ് ദ സെയിം ഇൻറ്റൻസിറ്റി ഓഫ് പെയിൻ ഓവർ ദെയർ. ഓക്കെ, അത് കഴിഞ്ഞ് നെക്സ്റ്റ് ഡേ 16th ഡേറ്റ എന്ത് തന്നെയാണ്, നോ ചേഞ്ച് ഇൻ ബാക്ക് പെയിൻ, വിച്ച് മീൻസ് ഹി ഹാസ് ദ സെയിം പെയിൻ ഓവർ ദെയർ. സോ യു കുഡ് കമ്പൈൻ, നമുക്ക് അവിടെ ആ രണ്ട് ഡേറ്റ കൂടെ കമ്പൈൻ ചെയ്ത് നമുക്ക് അവിടെ മെൻഷൻ ചെയ്യാം. നമുക്ക് പറയാം ഓൺ സബ്സിക്വന്റ് ഡേയ്സ്, തുടർന്നുള്ള ദിവസങ്ങളിൽ, ഓൺ സബ്സിക്വന്റ് ഡേയ്സ് ഹി ഹാഡ് പെർസിസ്റ്റന്റ് ലോവർ ബാക്ക് പെയിൻ. പെർസിസ്റ്റന്റ്, PERSISTENT, പെർസിസ്റ്റന്റ് എന്ന് പറഞ്ഞാൽ ഓൾറെഡി എക്സിസ്റ്റ് ചെയ്യുന്നത്. അപ്പൊ നമുക്ക് എന്ത് പറയാം, ഓൺ സബ്സിക്വന്റ് ഡേയ്സ് ഹി ഹാസ് പെർസിസ്റ്റന്റ് ലോവർ ബാക്ക് പെയിൻ, പെർസിസ്റ്റന്റ് ആയിട്ടുള്ള ലോവർ ബാക്ക് പെയിൻ ഉണ്ട്. ഓക്കെ, പെർസിസ്റ്റൻ്റ് ആയിട്ടുള്ള ലോവർ ബാക്ക് പെയിൻ ഉണ്ട് എന്ന് നമുക്ക് പറയാം. അതിൻ്റെ കൂടെ തന്നെ പെർസിസ്റ്റൻ്റ് ലോവർ ബാക്ക് പെയിൻ ഉണ്ട്, ദാറ്റ് ഇസ് 1 പോയിന്റ്. ആൻഡ് പിന്നെ നമുക്ക് പറയാവുന്ന കാര്യം എന്താണ്, ഹിസ് SLR ഹാസ് റെഡ്യൂസ് ടു 30 ഡിഗ്രി. ഹിസ് LR എത്രയായിട്ട് റെഡ്യൂസ് ചെയ്തു, 30 ഡിഗ്രി ആയിട്ട് റെഡ്യൂസ് ചെയ്തു. ആൻഡ് ഹിസ് റാൻഡം ബ്ലഡ് ഗ്ലൂക്കോസ് ലെവൽ ഇസ് 10 mmol എന്നുള്ള കാര്യം, മില്ലി മോളാർ പെർ ലിറ്റർ എന്നുള്ള കാര്യവും നമുക്ക് എന്ത് ചെയ്യാവുന്നതാണ്, മെൻഷൻ ചെയ്യാവുന്നതാണ്. Then finally today the data എഴുതാ. Today his pain increased overnight in back and down, with the left leg pain not controlled by any medication, and his lower left leg has become numb, and he was unable to get out of his bed. And finally his SLR value reached at 10 degree, and his blood glucose level increased to 40 mmol എന്നുള്ള millimolar എന്നുള്ള കാര്യം നമുക്ക് എന്ത് ചെയ്യാവുന്നതാണ്, ടുഡേ കോണ്ടന്റ് ആയിട്ട് മെൻഷൻ ചെയ്യാം. Therefore, and his condition is not relieved by the medication. Therefore, condition is not relieved by the medication. So this is the present scenario. So we have mentioned the social and medical history is the first body paragraph, and the initial, the 12th February data as the second body paragraph, and on subsequent days by mentioning that particular tag we put together the 14th and 16th data, and along with the same content you could write the today's information as well. And finally, in the discharge plan, you can say it would be appreciated. You could go with it. നമുക്ക് purpose words and synonyms നമുക്ക് അവിടെ യൂസ് ചെയ്യാവുന്നതാണ്. Orthopedic assessment and management എന്നല്ലേ നമ്മൾ പറയാം. സോ അതിൻ്റെ synonyms ആയിട്ട് എന്താണ് വരിക, orthopedic evaluation and treatment എന്നുള്ള purpose words introduction discharge planil ഉപയോഗിക്കാവുന്നതാണ്. So your discharge plan can be, it would be appreciated if you could provide orthopedic evaluation and treatment എന്ന് പറഞ്ഞ് നമുക്ക് ഈ ലെറ്റർ എന്ത് ചെയ്യാവുന്നതാണ്, ഡിസ്ചാർജ് പ്ലാൻ കൺക്ലൂഡ് ചെയ്യാവുന്നതാണ്. Then as usual we can wind up this letter by mentioning the conclusion, that is, please contact me for further information. Yours sincerely has to be written there, because Dr. Matthew Sebastian എന്നല്ലേ നമ്മളോട് പറഞ്ഞിരിക്കണേ, റീഡർ നമ്മുടെ പേരുണ്ടല്ലോ. സോ റീഡറിൻ്റെ പേര് നമുക്ക് തന്നിട്ടുണ്ട് എങ്കിൽ, if the name of the reader has mentioned over there, then you have to go with the ending clause as yours sincerely. Okay, so reader പേര് തന്നിട്ട് ഇല്ല എങ്കിൽ, if the name of the reader is not provided over there, you can write yours faithfully എന്ന് പറയാം. അല്ലാത്തതാണെങ്കിൽ yours sincerely. So here the name of the reader is there, Dr. Matthew Sebastian. So you can write the ending as yours sincerely എന്ന് നമുക്ക് മെൻഷൻ ചെയ്യാവുന്നതാണ്. And finally you can go with the designation of the patient. The designation of the writer. Writer and designation വെച്ചിട്ടാണ് നമുക്ക് പോകാൻ പറ്റുക. So writer and designation, it must be here. So who is a regular patient at your medical center? നമ്മുടെ മെഡിക്കൽ സെൻറ്ററിൽ ഒരു റെഗുലർ പേഷ്യൻ്റ് ആണ് എന്നേ നമ്മളോട് പറഞ്ഞിട്ടുള്ളൂ. They haven't provided any specific designation for the writer. So if nothing has provided as the designation of the writer, writerൻ്റെ designation ആയിട്ട് നമുക്ക് ഒന്നും തന്നിട്ടില്ല എങ്കിൽ എന്താണ് എഴുതാൻ സാധിക്കുന്നത്? You can write nurse എന്നുള്ള designation പോവാം. Because obviously OET nursing will be written by a nurse. But make sure you are going with the nurse, because registered nurse എന്ന് എഴുതാനായിട്ടുള്ളൊരു ടെൻഡൻസി നിങ്ങൾക്ക് ഉണ്ടാകാം. സോ അവിടെ നിങ്ങൾ മനസ്സിലാക്കേണ്ട കാര്യം, RN എന്ന് പറയുന്ന every nurse is not going to be an RN. So even if you are migrating to there, you have to clear certain exams over there. ആ എക്സാംസ് ക്ലിയർ ചെയ്ത് കഴിയുമ്പോഴാണ് നമ്മൾ അവിടെ എന്താവുന്നത്, എന്താണ് ഓസ്കി ഇപ്പോൾ പുറത്തേക്ക് പോയി കഴിഞ്ഞാൽ ഓസ്കി ക്ലിയർ ചെയ്ത് കഴിയുമ്പോഴാണ് നിങ്ങൾ അവിടുത്തെ RN ആവുന്നത്. അതുവരെ യു വിൽ ബി വർക്കിംഗ് ദെയർ ആസ് എ നേഴ്സ്, റൈറ്റ്? സോ അതുകൊണ്ട് നമുക്ക് എന്ത് ചെയ്യാൻ പറ്റും, RN അല്ലെങ്കിൽ നേഴ്സ് എന്നുള്ള ഡെസിഗ്നേഷൻ പോകാം. ആൻഡ് ഇഫ് ഇറ്റ് ഇസ് സ്പെസിഫിക്കലി മെൻഷൻഡ് ആസ് രജിസ്റ്റേർഡ് നേഴ്സ് എന്ന് സ്പെസിഫിക്കലി തന്നിട്ടുണ്ടെങ്കിൽ മാത്രം നമ്മൾ എന്ത് പോകാവുന്നതാണ്, യു ക്യാൻ ഗോ വിത്ത് ദി രജിസ്റ്റേർഡ് നഴ്സിനായി. Okay, so and your letter the last date in the 19 ആണ്. So which can be taken as today's date, 19 February 2018. ഇത് നിങ്ങൾക്ക് ലെറ്റർ ഹെഡ് ഡേറ്റ് ആക്കാം. അത് കഴിഞ്ഞ് we have seen the address of the reader, and reader the Dr. Matthew Thomas. What was the name of the reader? Okay, Matthew Sebastian. So അതുകൊണ്ട് നമുക്ക് സല്യൂട്ടേഷൻ എങ്ങനെ പോവാം, ഡിയർ ഡോക്ടർ സെബാസ്റ്റ്യൻ എന്ന സല്യൂട്ടേഷൻ പറയാം. അത് കഴിഞ്ഞ് നമുക്ക് റെഫറൽ ലൈൻ ഉണ്ട്, RE colon the full name of the patient, that is Mr. Alex David എന്ന് പറയുന്ന full name പറയാം. And 45 years old എന്ന് തന്നിരിക്കുന്നത് കൊണ്ട് aged 45 years എന്ന് നിങ്ങൾക്ക് എഴുതാവുന്നതാണ്. Then we have mentioned the introduction. The first body paragraph is going to be social and medical history. Second body paragraph is going to be the 12th data, 12th February data ആണ് നമുക്ക് second body paragraph ആക്കാം. And third body paragraph you can write the on subsequent days data as well as the today's data. Today data on subsequent days data കൂടെ എഴുതാവുന്നതാണ്. And what you can do is in between 12th അല്ലെങ്കിൽ 14th and 16th on subsequent days the condition has been still there. The condition is still there. There is no change in its condition. ഒരു ചേഞ്ചും ഇല്ല എങ്കിൽ you don't need to repeat it anymore. You could write what you can write it. He has persistent back pain. Persistent ആയിട്ടുള്ള back pain ഉണ്ട് എന്ന് നിങ്ങൾക്ക് എന്ത് ചെയ്യാവുന്നതാണ്, മെൻഷൻ ചെയ്യാവുന്നതാണ്. You don't need to write it all over again. And അത് കഴിഞ്ഞ് കമ്പൈൻ ചെയ്ത അതിൻ്റെ ട്രീറ്റ്മെൻറ്റ് പ്ലാനിനെ പറ്റി എന്ത് ചെയ്താൽ മതിയാവും, മെൻഷൻ ചെയ്താൽ മതിയാവും. Okay, so I hope it is clear, and that was the end of our today's live session. So I'll be coming in next week with yet another topic which is going to be useful for you people regarding your OET preparation. So thank you so much guys for being here with me for the past 30 minutes, and I wish you all the very best. Keep on working hard. Just prepare yourself to face the exam. So just practice every, consistent practice matters. So നമ്മൾ ഒരു കാര്യം ചെയ്തു തുടങ്ങിയാൽ കൺസിസ്റ്റന്റ് ആയിട്ട് അത് എന്ത് ചെയ്യുക. There shouldn't be on and off situations over there. ചില ദിവസം നമ്മൾ നന്നായി ചെയ്തു, ചില ദിവസം നമ്മൾ ചെയ്തില്ല. So അങ്ങനെ ഒരു on and off situation മാറ്റാതെ whatever that we are doing, just be consistent with that. അതെന്തായിട്ട് ചെയ്യുക, കൺസിസ്റ്റന്റ് ആയിട്ട് പോവുക. And consistent ആയിട്ട് പോകുമ്പോൾ definitely there will be improvement in your situation as well. So just be confident and go with your strong hard work, which is in a consistent manner, which will fetch you high scores. So we'll be meeting on next week. So till then, all the very best everyone, and thank you so much for being here with me, and I wish you good luck and good day ahead as well. Thank you.